Hi everyone. In today's video, we are going to be chatting with Dr. Tracey Marks, who is a psychiatrist practicing in Atlanta, Georgia in the United States with over 20 years of experience. She also has her own YouTube channel called Dr. Tracey Marks, which we will link to in the description below, where she has over 1 million subscribers and talks about various topics around psychiatry and mental health. In today's interview, we are going to be talking with her about alternative substances used to treat schizophrenia. All right, so hello, Dr. Marks. Thank you so much for joining us here today on our YouTube channel. It's wonderful to have you.
Thanks. I'm excited to be here. I've been following you. I know all about you, so thanks for inviting me over.
Yeah, it's great to have you. So in today's video, we are going to be talking about alternative substances being used to treat schizophrenia. So I think it's important to kind of start this off by pointing out that, we cover a lot of the traditional therapies and treatments on this channel, medications being a really important one, and then things like psychotherapies and exercise, nutrition, all those kinds of things that go into maintaining wellness with schizophrenia. But there is more and more evidence coming out lately about alternative treatments. And so I'm talking about things like ketamine and mushrooms or LSD, or these kinds of alternative things are coming more into the conversation around treating mental health disorders. And so I was wondering if you could just kind of give us an overview of what the current landscape looks like for using these alternative substances in the treatment of schizophrenia.
Okay, sure. So in the current landscape, these alternative options are still at the stage of being brought into the conversation. There still isn't enough evidence showing effectiveness for treating schizophrenia. So, for example, psychedelics are all the rage right now because we are getting close to them being FDA approved for treating depression. There's also lots of studies for treating PTSD as well. And it was hopeful that maybe low dosing or micro dosing the psychedelics could help with schizophrenia, but that's still kind of out there as far as still not quite clear about that. Why? Because the psychedelics trigger hallucinatory experiences, also altered states of consciousness, which could be different from a hallucinatory experience. And that's the last thing you want with someone with schizophrenia who already experiences that as part of their illness. So the idea was in looking at the psychedelics as a treatment for schizophrenia. First, one thought was looking at it as a model of if you have something that triggers hallucinatory experiences, maybe there's a way we can manipulate the system by studying these drugs and their effect on the brain to be able to kind of have like a backdoor approach to treating psychosis in schizophrenia.
Right.
So it's still, it's still very in the very early stages, is I guess the bottom line answer here when it comes to psychedelics. And also, I just want to clarify something when it comes to the psychedelics. There's the traditional, or what they call classic psychedelics, which work at the serotonin receptors. And then there's ketamine, which is a non-classic psychedelic. It causes hallucinatory experiences, which is where you get the psychedelic name from or classification. But it works at a different receptor, at the NMDA receptors, for those who want to know that level of detail. Ketamine, the studies I've seen anyway, ketamine, even low doses of it, can really trigger or worsen psychosis if you have schizophrenia. So, it's probably has the least amount of support for its use than the classic psychedelics.
Right. Okay. So these substances have been around for quite some time. Is there a reason that they're now coming to the forefront of research with respect to treating mental health disorders?
That's a good question. I think, first of all, it takes a long time to get research to the point where there's enough evidence to show or support this being standard treatment. MDMA has been in studies, or people have been working on that for treatment for depression for, I believe it's like 20 years. I mean, it's been a long time, and now it's finally getting close, maybe in 2023, to finish the final clinical studies or clinical phase trials. I think what's happening is that the work that people have been doing for the past decade, trying to gather enough evidence to show that these agents actually make a big difference in the treatment of the mental disorders, whether it be depression, anxiety, schizophrenia. We're just now like kind of seeing the benefit of those years of research. I think another reason that it's getting a lot of popularity right now is because, in general, with psychiatry anyway, we've been moving in the direction of the disorders being not a chemical imbalance. I know that's been a lot of talk lately. That's actually not a new concept, that it's not a chemical imbalance. But nonetheless, as we have moved from it's not a chemical imbalance, it's really the disorders are really related to the connectivity between the nerves in the brain, also called neuroplasticity. And when you have looser connections between the nerves, you get decreased functioning or impairment in functioning. And these drugs aim to tighten these connections. So as we have seen that effect, that it really boils down to the connection or the connectivity, that's when we have seen a surge in interest in what are the interventions that affect the connectivity. So the traditional antidepressants, say like Prozac and things that increase serotonin, it's not because you have a serotonin imbalance. It's because this connectivity problem reduces the amount of serotonin. So we're just kind of like using a Band-Aid to patch over increasing serotonin. But now the real treatment is to tighten up the connections. And so what does that? Some of these psychedelics do that, and other agents that are still in development.
Okay, that makes a lot of sense then. So can you talk more about some of these other agents, or are there types of herbal supplements or vitamins that have also been shown to kind of have this effect?
So some of the other agents that I've seen have names that I can't remember. They're like, AN236, things like that.
Right.
Um, but, and I've even seen some studies about looking at the NSAIDs, the nonsteroidal anti-inflammatory agents, also having or causing a similar effect of decreasing depression. And those are the studies I've seen through a similar mechanism of connectivity. And then there's other agents, again, that I can't remember the names of those. I wish we had herbal remedies. I really do. But I'm not aware of any that have solid evidence in treating schizophrenia for sure, but even depression and anxiety, it's very thin how many agents are actually create a robust experience or robust improvement.
Right. Are there any herbal supplements or vitamins or whatnot that might help in treating the side effects of some of these antipsychotics that are used in the treatment of schizophrenia? So maybe not treating the symptoms necessarily, but treating the side effects of medications.
Yeah. I can't think of any offhand that would treat the side effects. So the main side effects that we'd be looking at here are weight gain, being too tired or sedated. Those are kind of the big ones. Certainly there's more serious ones like Clozaril can cause neutropenia, which is a serious drop in your white blood cell count, which means that you could get infections and things, but there isn't anything to treat that other than to stop the medication. Other kind of more random-ish side effects would be, headache, trouble sleeping, things like that, or maybe even agitation. When it comes to weight gain then can lead to metabolic syndrome, which really is a kind of a syndrome or a collection of symptoms that include abnormal blood glucose breakdown, or you end up with elevated glucose levels similar to someone developing diabetes, increased blood pressure, increased triglycerides and cholesterol levels, and then also then the weight gain. So any of those symptoms could be addressed potentially with herbal supplements, like, something herbal that could reduce your cholesterol. And I don't have one to name because I don't treat cholesterol or high levels of cholesterol directly. One of the best ways to deal with cholesterol is decreasing your carb intake. The ketogenic diet has been studied as a treatment option for schizophrenia. We're still not there yet as far as seeing enough evidence to show that, yes, this is what you should do. I still have patients, though I will recommend it because it is shown to be favorable for people with schizophrenia because of the high fat content. And because with schizophrenia, we have seen that there's areas in the brain that are thinner and, have less nerve density. The nerve sheaths, or the coating around the nerves, are partly from fat. The content of that is fat. So these high fat diets are thought to help schizophrenia that way. That's one of the mechanisms. And then there's other more complicated mechanisms as well. So that's not an herbal remedy, but it's a natural approach to, one, reducing the weight gain issue, as well as treating the illness itself.
Right. Yeah, no, that's very interesting. I've looked into the ketogenic diet myself and was conflicted as to evidence and whatnot. So I guess that's kind of an emerging thing. All right. Well, thank you so much for sharing your knowledge and expertise around this area. It's really interesting to hear more about, why these substances are maybe starting to come into prominence around treating things like schizophrenia. So thank you for sharing that knowledge with us.
Absolutely. You're welcome. Thanks for having me.
All right. Yeah, thank you. Take care. So a really big thank you again to Dr. Tracey Marks for being here with us to talk about alternative substances used in the treatment of schizophrenia. I really learned a lot from her, and I really appreciated her coming to share her knowledge and expertise. Again, you can find Dr. Tracey Marks' YouTube channel. We will link to it in the description below. Make sure to check out her channel as well. There's lots of really, really great information there too. Also, just a quick reminder that if you would like to help support us in creating content like this, make sure to check out the link to our Patreon page in the description below. Through Patreon, you also gain access to our online peer support community where we offer various types of peer support, including weekly peer support groups that are facilitated. So if this is something that interests you, or if you just want to help us in creating content like this, please make sure to check out the link to our Patreon page. Thank you so much again for watching, and as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.